Hello, everyone, and welcome back to this series. This is episode 2 of the 7 episodes which we will shoot in this short series on the most common dental problems. In the last episode, we discussed about bad breath. Now, let's continue from the same. In the bad breath, we understood that when the food debris gets stuck, it is the bacteria which release that odorous substances and which results in bad breath. The bacteria also, when they use up the food, release acids. They are basically lactic acids in nature. These lactic acids create concavity on the hard tissue surfaces, that is the tooth surface. When they create that concavity, they eat out the calcium and the phosphorus from the tooth. And now they have created a cave for themselves to live in. The food comes in, the bacteria grow faster. The food comes in, the bacteria will grow faster. We are not able to clean it well, the bacteria will grow faster. And this is the reason for tooth decay. The basic reason for tooth decay is in acidic pH of the mouth, the calcium is dissolved. Once the calcium is dissolved, the concavity is formed in which the bacteria can very comfortably stay, and they keep on dissolving the calcium. As and when they reach on the dentin area, that is the second layer of the tooth, we start complaining of sensitivity. We will discuss about sensitivity in further episodes. But just for an understanding, when it reaches the second layer and whenever we drink cold water or a sugary substance, the second layer has certain tubules or has certain tubes which give us the sensation of sensitivity. Now the bacteria have again started to grow, they are still growing and they reach the pulp. The pulp is that area which has the nerve. It has a nerve end. And as soon as these bacteria reach the nerve, the body creates a series of reactions which causes this nerve to cause pain. Hence we see a lot of times a patient do say that we have very deep cavity but it is not paining. The reason for that could be that either that cavity has not reached the nerve yet, or it has reached the nerve, it has destroyed the nerve, and hence there is no pain. Second, we also see a lot of patients ask, can we apply clove oil? So clove oil is also present in dentistry in form of eugenol. The effect of eugenol, it acts like an optium, which means it reduces all the sensations from the tubules or the tubes which are present in the second layer. But it is going to exacerbate or increase the pain if it reaches the pulp or the third layer. Now the question comes, as you are at home, you will not be aware that what is the depth of the cavity. Is the cavity reaching only the dentin or has it crossed dentin? That is why applying clove oil is a very risky job. If clove oil is applied when the cavity is only at the dentin level, it will give you symptomatic relief, which means only relief from pain. It is not going to create any other benefit. But if it has reached the pulp, it is going to create such tremendous amount of pain and inflammation that you might have to visit the dentist within the next hour. Hence, it is quite risky to use this clove oil as a home remedy for cavities. Third, okay, I have had cavity, I did not take care, or I took care, I wasn't sure what to do. What should you do next? Okay, I have my dentist appointment next week, but what can I do in my regular habit to prevent this cavity? Start eating fluoride-rich food. What does fluoride-rich food mean? Any food substance which is green in color, is raw from nature, usually contains a lot of fluorides. It may be your leafy vegetables also contain fluorides. Most of the urban areas in India or abroad would have artificial fluoridation in water as well, but you will have to check it out yourself. The other thing you can do is brush twice a day. Frequently use mouthwash which contain fluoride as well. That will also help prevent the spread of these cavities. We have also seen that an active cavity with appropriate use of fluorides could convert into an arrested cavity which means the cavity is there but it is not growing. This is all the game of pH and how hard the tooth surface is. Is it only calcium or is it a fluoride layer over the calcium as well? But if you have got a cavity, then what you can do? If you have got a cavity, visit your dentist. If the cavity is small, the dentist would just let go with the filling. If it is deep, then he may use multiple chemicals, one to create a barrier between the filling and the nerve, that is called as a calcium hydroxide layer, or he may then proceed, or the dentist may then proceed to do a conservative approach using root canal therapy or pulp therapy. If the infection is spread to the pulp, then for sure we will have to undergo root canal treatment. The root canal treatment in non-infective cases where the infection has not crossed the tooth and gone into the bone is relatively painless, and the healing period is also very less. But say you have got a cavity and now the tooth is also broken completely, no problem. Once the tooth is broken and because of a cavity, usually the pulp would undergo necrosis. There would not be a lot of pain in that case, in most of the conditions. In those conditions, we will try to save the tooth, but if we can't, then we will have to replace it using dental implants. But it is important to nip the bud of any infection at the nascent stage as well. So it is always advisable that you visit your dentist every 6 months to a year, get a full checkup done, so that if a cavity is starting, the dentist can warn you, can advise you on the diet, can advise you on different other modalities which can be used to control the dental cavity. Some people will be more prone to cavities whereas others won't, but you can't be sure. Hence it is always advisable that you visit your dentist. Hope you are liking this series, and if that is so, please do watch. Next time we will come up with mouth sores or oral ulcers. What can we do, how it happens, and how does it progress? Thank you.